First of all, I really like that the consensus is patient focused. In all cancers, patient is in focus, but even more so with CTCL, because as I have mentioned, it is a lifelong disease. So for some lymphomas, we follow patients for a limited time period and we can cure them. But with CTCL, we have to follow these patients for the rest of their life in majority of cases, and the disease has relapsing, may progress throughout the years. The consensus is very important. First of all, it calls for access to expert referrals and to resources for these patients. And that, as I have mentioned, is the key, because these patients need a lead physician to help them establish treatment course and to understand their disease. Consensus also calls for providing support to clinicians to establish multidisciplinary clinics to help with this patient's care. And multidisciplinary clinics are really fantastic. We have multidisciplinary clinic where patients are seen by radiation oncologists and dermatologists and lymphoma specialists at the same time. These clinics help patients feel empowered. They see and understand that we work together as a team. These clinics help gain trust and expedite time to diagnosis and appropriate treatment. And really, they help establish trust with patient to the point where potentially even in the future, we need less visits for these patients because they understand the disease course better, and they understand that they're in good hands. But unfortunately, these clinics may be hard to organize, especially in the current healthcare environment that is very fast paced. So definitely it would be nice to have support in organizing such clinics, maybe have experienced sites teach not so experienced sites on how to run such clinics. Additionally, the consensus calls for expanding resources in under-resourced countries, which of course is extremely important. As I have mentioned, these patients need multimodal approach, expert pathology, and also they need access to very expensive medical therapies in some cases. Providing access to care in under-resourced countries is essential to help these patients. The consensus also calls for developing new technologies. That is important because I think that despite the fact that medicine is moving forward very fast, we are still in kind of archaic times in terms of medical records, because our medical records are not shared between different institutions. We still have to request them as paper records. Sometimes it's hard to obtain pathology slides and review. So again, having technology, for example, that would help us have universal access to medical records would be tremendous. Having technology that would help us have access to patients' pathology slides, having technologies that maybe would help aid in diagnosis of this disease, such as AI technologies that would help with pathology analysis, would be incredible. One of the most important points in the consensus is driving awareness of this disease, because I think that really very few clinicians think about CTCL. It doesn't come up very often. It is a rare disease. And when it does happen, when the patient comes with this diagnosis or the biopsy comes back with this diagnosis, I think sometimes the clinicians are very concerned and they themselves are a little bit timid or scared. And then subsequently, patients feel the same way. And so there's basically a lot of fear that can be associated with this diagnosis. So just having a document, having a statement that even educates primary care providers, dermatologists, community oncologists on this disease is extremely valuable. I can actually sense that there is increasing awareness of CTCL diagnosis, and the fact that it is best to refer these patients to the centers of expertise. Several incredible organizations that are active in CTCL, such as Cutaneous Lymphoma Foundation, and also International Society for Cutaneous Lymphomas. So just having these sites available is extremely useful. And these sites provide lists of experts in the disease, experts that can be referred to or contacted. Many more referrals now for the specialist care of this disease. I think that in general, these patients can be treated locally, they can be treated in community, but in conjunction with an expert. And a lot of times I share these patients with community providers, greatly improves the care of these patients and has an impact on disease course.